Have you ever wondered why your erections are not as strong as they used to be? Why sometimes you lose your erection faster than you want? Why some men can maintain strong, long lasting erections and others struggle even when they feel desire? Is it testosterone? Is it age? Is it psychological? Or is it something you're doing every day without even realizing it? Because here's the truth: most men who have erection problems don't actually have a serious medical condition. They have small habits, small imbalances that are quietly destroying their performance. And the good news is that most of these things are completely reversible. So, in this video, I'm going to show you the 5 key factors that will help you get stronger erections, longer lasting erections, and better sexual performance. And more importantly, I will explain why they work so you actually understand your body. Stay with me until the end because the last factor is one of the most underestimated and one of the most powerful. Now, before we continue, let me quickly introduce myself. My name is Dr. César Noval. I'm a plastic surgeon specialized in male sexual health, penile enlargement, and gender affirmation surgery. We have clinics in Spain, Mexico, and Miami where we treat patients from all over the world. Our main YouTube channel in Spanish, Clinica Nef, already has more than 100,000 subscribers. And we've created this English channel to bring high quality medical information to an international audience. We are also using artificial intelligence to translate and expand our content so we can help more men understand their bodies and improve their sexual health. Now, let's understand something very important. An erection is not just about blood. It is a complex process that depends on three main systems working together perfectly: blood flow, the nervous system, and hormones. If one of these fails, your erection will not be as strong as it should be. So, improving erection is not about one trick or one supplement, it is about optimizing your entire system. Let's start with the first and most important factor: blood flow. An erection is essentially a vascular event. Blood needs to flow into the penis and stay there. If your blood circulation is not optimal, your erections will be weak no matter how much desire you have. This is why many cardiovascular conditions are directly linked to erectile dysfunction. Smoking, lack of exercise, poor diet, high cholesterol, and high blood pressure all damage your blood vessels. And the penis is one of the first places where these problems appear. In fact, in many cases, erection problems are an early warning sign of cardiovascular disease. So, how do you improve blood flow? The answer is simple but powerful: regular exercise, especially combining strength training and cardiovascular training, a clean diet with less processed food and less sugar, maintaining a healthy weight, staying hydrated. These basic habits can dramatically improve your erection quality. This is not theory. We see it in patients every day. Now, let's talk about testosterone. Many men believe that testosterone is the key to strong erections, but this is only partially true. Testosterone is very important for libido, meaning your sexual desire, your energy, and your motivation. But most erection problems are not caused by low testosterone. In fact, many men with normal testosterone levels still have weak erections. The real issue is usually blood flow or neurological stimulation. That said, optimizing testosterone is still important. And how do you do that? Again, not with shortcuts. Sleep is one of the most powerful factors. If you sleep poorly, your testosterone drops. Strength training also increases testosterone. Reducing stress is essential because high cortisol lowers testosterone. And maintaining a healthy body fat percentage is key. These are the real drivers of hormonal health. Now we move to one of the biggest problems today: the brain. Erections start in the brain. If your brain is not properly stimulated, your body will not respond. And today, one of the biggest issues affecting men is overstimulation, especially from pornography. When you consume a lot of porn, you expose your brain to constant novelty, unrealistic scenarios, and very high levels of stimulation. Your brain adapts to this, and over time, normal sexual experiences become less stimulating. This leads to what we call desensitization. You need more stimulation to achieve the same response, and this can cause weaker erections, difficulty maintaining them, and reduced satisfaction with real partners. This is what we see more and more in young patients. And again, this is not a testosterone issue, this is a neurological adaptation. The solution is to reduce artificial stimulation and allow your brain to reset. Focus on real interactions, real experiences, and lower stimulation levels. This alone can have a massive impact on your erection quality. Now, let's talk about stress and anxiety. This is one of the most underestimated factors. When you are stressed, your body produces cortisol. Cortisol is the opposite of what you need for an erection. It reduces blood flow, increases tension, and puts your body in a state of alert instead of relaxation. And erections require relaxation. On top of that, stress often leads to performance anxiety. You start thinking too much, you start analyzing your performance, and that creates a negative loop. You fail once, you worry about it, and then it happens again. This is extremely common. In many cases, the body is perfectly capable, but the mind is interfering. Managing stress is essential. This includes improving sleep, reducing anxiety, being present during sexual activity, and not overanalyzing performance. Sometimes the biggest improvement comes not from the body, but from calming the mind. Now let's bring everything together with the final factor: lifestyle. Your erection is a reflection of your overall health. It is not isolated, it is connected to everything you do daily. Sleep, nutrition, exercise, stress, and sexual habits all play a role. If these areas are optimized, your erections will improve naturally. If they are not, no pill will fully solve the problem. This is where many people look for shortcuts. Pills like Viagra or Cialis can help temporarily by increasing blood flow, but they do not fix the root cause. If your lifestyle is poor, you will depend on them. If your lifestyle is optimized, you may not need them at all. So, what is the real message of this video? Improving erections is not about one trick, one supplement, or one medication. It is about understanding your body and optimizing the key factors that truly matter: blood flow, brain stimulation, hormones, stress, and lifestyle. If you focus on these areas, you will not only improve your erections, you will improve your overall health, your energy, and your quality of life. And that is the real goal.
If you found this video useful, make sure to subscribe to the channel because we are going to keep bringing you real, science-based information about male sexual health. And if you have any questions, leave them in the comments. I'll see you in the next video.